Hospitalizations can be a planned event or an unexpected emergency, while planned trips to the hospital are less frantic and can be easier to pack for. It is always smart to have things ready at a moment's notice, just in case you have to go to the emergency department. While no one enjoys spending time in the hospital, there are things you can do and items you can bring which will help make you feel more comfortable. The two most important items to bring with you to the hospital are your photo ID and your insurance card. While hospitals will not refuse to treat you without these items, it makes the billing and insurance process much easier if you have these in your possession. If you are concerned you may lose these items or forget to take them with you, take a photo of your insurance and ID cards and store them either in your email or on your electronic device. In a pinch, you may be able to use these photos to substitute for your actual cards. Many hospitals will advise patients to have a list of your medications with you. This list should include the name of the drug, the dose, the frequency, and the time of the last dose. While it is very important to have this information, I'm going to tell you a big secret. Bring along your own medicine to the hospital. While a hospital should be stocked with everything you take at home, many hospital pharmacies may not have all your medicines available. The medication may need to be ordered, and it may take a few days to arrive at the hospital. Also, if you go to the emergency department, many times you will not receive your home medications while there. Having your own medicines with you will help you avoid missing a dose. Additionally, if you're admitted to the hospital, a doctor must sign off on your home medications. Then, a pharmacist must also approve your medication list. I have had issues in the past with doctors not agreeing with my home medications or simply forgetting to approve them. I have also had pharmacists disagree with my home medication dosing. The medicine is denied and I'm given nothing. This can be very dangerous. The one medicine I'm repeatedly having trouble with is my digestive enzymes. I need to take these pills to break down the food I eat. If I do not take them, food stresses my pancreas and causes pancreatitis. If I'm not given digestive enzymes while hospitalized, it is a choice between starving or eating and getting pancreatitis. To avoid this hassle, I always have a supply of all my medicines I use in a backpack. At a moment's notice, I can grab my backpack and know I will have enough meds to last me a week. Whether you eat food by mouth or have a feeding tube, it is wise to come to the hospital with at least a 2-day supply worth of food. If you're able to eat by mouth, ideally you should be able to get food once you are admitted to the hospital. But anytime you spend in the emergency department, plan to have no access to food. If you do not bring anything to eat, you will most likely go hungry. The time spent in the emergency department can vary, but I always plan to stay at least 24 hours from the time I'm taken back to an exam room to the time I'm given a room in the hospital. If you have a feeding tube, bring along the food and supplies you will need for 2 days. If you're in the emergency department, you will most likely not have access to formula or feeding tube supplies. Once you're admitted to the hospital, a doctor must sign off on your nutritional needs. It may take a few days for everything to be approved. I have a bag with extra supplies of my most used respiratory items. I have an extra tracheostomy tube, extra tubing connectors, a trach tube tie, gauze, an extra water chamber, and a few other items. While having these items with you is wise, I will tell you I do not bring my extra medical supplies with me to the emergency department. The ED is very busy. You may be moved to a different room or be taken to X-ray or CT. With all this movement, it is very likely your medical bag may be misplaced. Instead, I give this bag to my mom. She holds on to the bag until I'm admitted to the hospital. Once I have a room, she brings the bag to my room if she's able to visit me. If she's not allowed to visit, I have her keep the bag in her possession. If I need something, she will drop off the item at security. Although my mom could drop off the entire bag at security, I do not want to risk having my bag full of respiratory supplies getting lost or misplaced. If you're at a large medical center, it is possible the hospital may have your respiratory supplies on hand. If you need something, always check with your respiratory therapist to see if he or she has what you need. Since I am limited with the supplies I receive from my insurance, I prefer to use the supplies from the hospital over using my own items. Hospitals provide many things, including a toothbrush and toothpaste. However, they only provide a small plastic comb to brush your hair. If you have very short hair, this may work. For me, I need a hairbrush to get through my hair. Although I may not be able to wash my hair for a week or more, being able to comb my hair and get it out of my face helps me feel so much better. If you have an extra charger, place it in a bag with your home medicines. I cannot tell you how many times this tip has saved me because I almost always forget to grab a charger for my electronic devices. If you forget to bring a charger with you to the hospital, ask your nurse if someone on the unit may have a charger for your device. If a charger cannot be found, look in the lost and found and see if there is a charger available which will work for your device. Most hospitals are very noisy. Bring along some headphones so you can listen to things on your electronic device. To go to sleep at night, I almost always wear earplugs. I will then place my headphones over my ears and turn up the volume on my electronic device. This trick helps block out the noise and helps get me a good night's sleep. Although hospitals dissuade you from bringing along electronics, during this time when visitor policies are strict, you will need to rely on electronic devices to communicate with family and friends. A mobile phone is good to have, but I will warn you, the reception inside hospitals is often poor. Making phone calls may be really hard to do. I like to bring along an iPad. Hospitals usually have free internet, and the iPad is much better at connecting with the hospital internet than the mobile phone is. I can use a variety of applications to communicate with family and friends. Also, the iPad provides a larger screen to watch videos on. Some people like to be very comfortable while hospitalized. I am not that person. Instead, I prefer to go to the hospital with as little luggage as possible. I try to wear comfortable, loose-fitting clothes to the hospital or the emergency department. I usually change into the hospital gown, but I will wear my pants as pajama bottoms. I will also bring along about 3 pairs of underwear. If you need more, remember you can always turn your underwear inside out and wear them again. So, 3 pairs of underwear plus the ones you are wearing equal about 7 additional days of underwear. Hospitals are almost always cold. Sometimes you are able to get a warm blanket, and sometimes you are not. For this reason, I often bring along a thick winter jacket with me to the hospital. My jacket is bulky and has a hood. If I put the jacket on backwards, I can put the hood over my face. This acts as a mask to keep out the bright hospital lights. Lastly, I do not bring along socks with me. Almost every hospital I've been in have hospital socks. They are not the most glamorous, but they keep your feet warm. During my first hospitalization in 2008, I learned the hard way how precious taking a shower is. I had emergency surgery, which left me with an incision from hip bone to hip bone. I was not able to take a shower for a month. Since this experience, I always try to take a shower before going to the emergency department or hospital. I wash my hair and quickly rinse off my body. Having a tracheostomy and ventilator means I'm more likely to be placed in the intensive care unit or the intermediate medical unit. Both these units do not have showers. Moreover, regular hospital rooms do not always have showers which accommodate my needs. With this in mind, I try to always shower right before going to the hospital. Yes, that means I often show up at the emergency department with my hair dripping wet. Please note, if you're having a life or death situation, go directly to the emergency department and skip the shower. But if you're not in a life-threatening situation, you may want to bathe before leaving home, as you never know when you might next have the opportunity to do so. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.